Hi, this is Dr. Jesse Taylor coming to you from the Children's Hospital of Philadelphia. I hope you'll join me in reading a wonderful article titled Clinical Outcomes of Bilateral Cleft Lip and Palate with Nasoalveolar Molding and Gingivoperiosteoplasty from Birth to Facial Maturity. Now, why is this article so important? For the first time, it shows that patients who've undergone the NYU protocol, which starts with nasoalveolar molding, followed by cleft lip repair, at which time they repair the nose and do a gingivoperiosteoplasty. That's closing the gap that exists in the upper jaw. And then followed by bone grafting for those who need it in mixed dentition. And then a large number of these patients go on to need jaw surgery at skeletal maturity. But for the first time, it's showing that doing a gingivoperiosteoplasty at the time of lip repair does not have an impact on facial growth in comparison to a control group that they used. And so I hope you'll join me in reading this article. It does suffer from a couple of shortcomings. Number one, it's a small sample size, 24 patients. And it uses a historical control group, which some of us might consider to be a little too historical, given that it's from several decades ago, in which a median of 8 operations were needed for each patient, as opposed to 5 operations, which is what they're showing in the NYU group. So these are cord cuttings patients studied over a period of 20 years, and it's showing that doing the GPP or gingivoperiosteoplasty in infancy does not result in worse facial growth than those who haven't had GPP. So please join me in reading this really important article from our colleagues at NYU this month.